Hey, it's Chris Lee from Life Abundant Consulting. How's it going today? It's Friday. Excellent. We are here at the Madison Center in Seattle, and I wanted to bring to you three things that are really motivating me in my life right now. One is my mission for primary care. Two is bridging the medical community with the wellness community. And three is how we, as providers of health, heal ourselves. So I wanted to start with my first mission, which is primary care. Primary care, it's part of the world I've been in for the last 17 years. And I just feel like there's a huge opportunity in primary care to expand our idea of health and our approach of health from moving from disease orientation, which is primarily the medical model. What is it that we're preventing? What disease are we preventing? What disease are we managing? What disease are we trying to find out and take care of? But there's way more to our health than disease orientation. And so my big idea for primary care approach is to really expand and spend some time and focus on what it is that the individual patient really believes is their optimal health. Bringing a vision in their mind, what they believe optimal health is for them, and also what they believe is a fulfilling life. Because as primary care doctors, we get a little bit more time to spend with individuals on their beliefs, and ultimately their beliefs are what are going to be the things that change their behaviors. So I would love it if primary care doctors and medical providers of all sorts, whether you're a nurse practitioner or a physician assistant, would add in their problem list, you can call it a problem list if you're not part of this medical world, a vision. And that vision would be the patient's idea of what they would love in their life for optimal health. And then also what they believe would be a fulfilling life for them. And then for medical providers to be able to support them in any possible way they can in achieving this optimal idea of health and optimal idea of a fulfilling life. Now, I don't want to exclude at all the wellness community, and that's my second goal today, is to talk about how can we bridge the medical community with the wellness community and bring them together to do the ultimate good that we're all trying to do, which is to increase the betterment and health of the client or the patient that we're working with. And here we are, oftentimes in a battle of medical community saying, be careful of that wellness provider, or the wellness provider saying, be careful of that medical community or that medical provider. And I just find there's a lot of tension sometimes, and why is there a fight, I guess, is what my question is, because we're all going towards the same goal. And so how do we bridge the relations between the medical community and the wellness community is a question that I'm holding in my mind, because I know that we both have so much to offer and supporting each other, and ultimately bringing the greatest health to the individuals that we serve. So I do want to just give a shout out to all the incredible work that our healthcare community is offering, and I'm just saying that the healthcare community includes everybody who is involved in taking care of patients, whether that's doctors, nurses, physician assistants, nurse practitioners, medical assistants, the front desk, naturopaths, acupuncturists, massage therapists, yoga instructors, spiritual leaders, energy workers, life coaches. There are so many of us out there who are doing incredible work to increase the health and life of the people that we serve. So let's bring this community together and really support each other in the work that we're doing, which is really the common goal that we're all seeking. The third thing that I wanted to bring up today was this skill of helping ourselves first, change our behaviors in the direction of the area, in the direction of what we believe to be a fulfilling life, and our optimal health. And the way we really change our behaviors to do that is through a change in how we think. So there is thinking and there is behavior change, and ultimately how we do and act and behave is going to be the reflection of what our health is, and also what our results are in a life that we're living right now. So how can we change the way that we think to be able to create the emotion, which is somewhere in there, to then have the emotion to change the behavior to create the things that we love in our life. And that's a skill. And if we can bring this skill and knowledge to not only ourselves in creating the life that we love, but then also in helping our patients and clients change their thinking and ultimately their behavior, so they can make the steps and the progress of success towards a life of their optimum health, and as well their idea of a fulfilling life. Then we would be changing this whole nation's disease process, or I would say whether it's diabetes or heart disease or back pain, or imagine if we were able to really impact and influence people's ability to change their behaviors. Most all of those things would disappear, or certainly improve. So anyway, happy Friday, and thank you for listening to my mission here in life, and for joining me if that's something that you are interested in. I love that we may be different, but we're all joined by the idea and willingness to grow. So come, I'd love to meet you. Make some comments below, and we'll talk soon. Okay, take care. Bye-bye.